Good afternoon, everybody. My name is Nora McCormick, and I serve as director for the Office of College Career Life Readiness, and I'm so excited to be here in their first annual conference looking at mental health and supports for our community in partnership with DHR and Region 1. So today's session is going to be about social emotional learning and mental health supports for everyone. So when we're looking at that, I want us to think about what does that mean for us. As I was coming over to the Renaissance and I'm thinking about what are the supports that I have and the beliefs that I have as a person in everything that I do. I'm a person who believes in abundant thinking. I believe that we are here to support each other. We're here to help each other. All of us are here for each other, and that really gives me a lot of, do I continue? A lot of strength in the work that I do and the supports that we provide. So we need to make sure that, we're supporting so many people. We're educators, we're professors, we're teachers, we're researchers, but we also need to support ourselves. So in the work that we have done as a community and with the service center, it's important that we continue and expand efforts and learning opportunities because we can learn so much from each other. We can help each other move forward to ensure that we do the best for this community that we love, the community that we're from, first generation American. I love that I have the opportunity to create more and also for our educators. But I want to the region one. Sometimes students are not aware that they could benefit from additional supports or that they're not self-regulating or that they need additional mentoring or counseling. I also work with Melissa Lopez. She and I have been colleagues for many, many years. And we work in this office at Region 1 where I say we support from Laredo to Brownsville and all the way to Brooks County. We work with counselors, with teachers, with students, with administrators to provide all supports. Ricardo Lee Lopez is the coordinator now for the College Now grant, and he works directly with Gear Up, but also he has work with SEL for families, and I'll talk a little bit about that in a little bit. And I already introduced myself. I also have Hope Rodriguez, who's an education specialist, and she works also with families, with our community, to make sure that everybody gets the best supports. We also have Rosie Ochoa, who worked in the Laredo office, supporting our work. And Annabelle Rangel, she's the director for the office in Brownsville, and she directs all supports in that area for our schools. We also have Dr. Darlene Rogers. She's the director for the Laredo Extension Satellite Office, and she does all supports in that region in Laredo. You heard earlier from Nicole Science. She is the director, the coordinator for the project College Ready with Gear Up. And you heard a little bit about, get off of that thing and do exercises and, exercise, help yourself, drink water, do all those things that are going to help you. We also have Sylvia Vargas, who is an education specialist and has worked extensively with families. So when you look at the core for SEL, you look at the center. Today we're talking about mental health, but when you look at mental health, it's mental health and also look at the social emotional learning components of mental health. So I was talking to you about self-management. How do you manage yourself, your schedule, your time, the things that you know are important, right? And when you make decisions, how do you look at how your decisions are affecting you and others? Also looking at your relationship skills. A lot of the work that I have been able to do for so many years has been through relationship and partnership with others. Getting along with others is so important. Learning how to work together, how to look at the strengths of people and not the deficits. Looking at people's strengths to figure out, okay, how do we build from those strengths so that we can continue to provide the best that we can. Social awareness, being aware of, your social connections, being aware of when sometimes you might not feel as connected or you might be more of an introvert, but you expand and you figure out, okay, who can be my partner or my person that I can go to if I need support. So as you continue to do that, we know that skill development in that area happens. We know that we're all work in progress. I always tell people, I'm a work in progress. We heard earlier about nobody's perfect. We all make sure that we learn and we continue to learn as we continue in life. We have these opportunities because if you look at the growth mindset and that research that's out there, there's a lot of research that shows you that you can learn the skills to learn how to develop friendships, to learn how to create partnerships so you can study together with other students when you go to college, to get yourself out of that shell, which is a little tough sometimes, right? But it is possible. It is possible if you have that growth mindset. Now, if you go around saying, oh, I don't want to learn that, this is who I am, I'm never going to change, that is not the growth mindset. The growth mindset is all about looking at opportunities when you see challenges and saying, I haven't learned that yet. I might not know it right now, but I'm going to study it, I'm going to learn it, and I'm going to get better at it. Self-awareness, also looking at the areas where maybe you say, you know what, I have all these strengths, but I need some people to support me with these other areas. And being aware that that's going to help you and your community and everybody else. So you look at social emotional learning, and around there, you see in your schools, we are building up a lot of the capacity for your counselors to have these supports with curriculum, with professional development for them. And also when you look at the school-wide practices, when you look at your school, and you walk into your school this fall, feeling like you are connected to that community, figuring out who's going to be there to support you. That's really important. The same thing for teachers and educators. We all want to feel that connection where we can go to a place and we can feel safe. So this is what this model looks at with SEL. And I want to talk a little bit about the work we're doing with counselors. So in the work that we're doing with counselors, I was mentioning to you that we have a Region 1 SEL mental health learning team. And these 4 individuals are actually in our office. They have extensive background in counseling. They have been doing counseling and support in our schools. We have Joe Castillo, who I mentioned earlier, who will be here this afternoon. We have Rosie Franco, who also works with adult learners and uses a lot of the skills with social emotional learning with them. Because the adult learners come in and they're not as, they might not be as comfortable coming in and taking GED classes as adults, but she makes them comfortable, and that team makes them comfortable by using social emotional learning skills and supports. We also have Jennifer Avelar, who is a transition facilitator that also does that support with adult learners and makes sure that she integrates SEL into that area and also the Counselors Academy. We also have Rosa Isela Herrera. She works with PATHS and also as an education specialist in general with us to make sure that our counselors and others receive that ongoing support, and she integrates some of those efforts in the work. So when we surveyed our counselors for this fall, we wanted to know, are we on target with what we're covering, or should we look at adjusting the efforts? When you look at this chart, you can see a lot of different colors, but you can see that the counselors told us that still 82 responses that stress and anxiety in students is something that they want to continue to address. So we are looking at addressing that so that we can support our counselors and they can support you as students. They also had about building resilience in students. So building resilience in students, sometimes, when we were in the middle of the pandemic, it seemed like everything was going to be tough and we didn't know how to get out sometimes of that place where we couldn't figure out how to bounce back. So resilience, a lot of times people say, You just got to keep going and move forward. But I got to tell you, it also means knowing where to find help. It also means knowing that there's a counselor or somebody there that you can call. It also means that you can email somebody and say, hey, can you help me out? I'm having a hard time. Building resilience in students, when you're resilient, it doesn't mean you have to do it all alone. It means that you learn how to help yourself out in whatever situation, whether it is that you go to a family member, a friend, a counselor, somebody that can help you when you're not feeling well. Or sometimes we're not aware that we're not feeling well. Sometimes we just keep going and going and going, and we have to give ourselves time to pause and reflect and check in. How am I doing today? How am I feeling right now? Am I feeling so stressed that I can't think clearly? Having those checkpoints. Earlier I saw where they talked about the STOP acronym. And the STOP acronym has to do with, you have to stop and you have to check yourself in. Am I okay? Sometimes when you are trying to figure things out for problems, we might tend to overthink. Overthinking is sometimes harmful to us. Thinking too much, we have to get to a point where we can say, stop. I got to stop thinking, and I got to figure out what actions I can take, right? So when you start taking actions and moving forward, that's when you start seeing yourself, okay, you know what? I took this next step, and then I'm going to take the next step, and that's going to help me out. So we are working with our counselors with some of these areas so that they can help you ensure that you get the supports you need in moving forward. And so these are the 3 areas. They also included social emotional learning. So we're going to continue to use that model that I shared with you in those areas. Now, when we're looking at SEL for families, what does that mean? This is the Region 1 Social Emotional Learning Team that's focused on family support. I already introduced you to Joe. You know a little bit about Lee. You know me, and there's Hope and Sylvia. This past spring and summer, we worked extensively with our parents, with our families, as they were at home struggling to figure out what to do next. We heard a lot of stories and a lot of things they said they needed to support them. And a lot of our conversations with them were actually just conversations, just listening to them and giving them some tools that will help them so they could help their children. So during the time that we had together, we learned a lot more about them, and we learned how strong our community is. We have a very strong community that really focuses on our parents and our families. We're working at helping their children, at ensuring that their children were okay, and they wanted to do the best. And what we told them is, you know what? There are 3 lessons that we covered, and one of them is locus of control. There are certain things that we can control and certain things that we cannot control. And it's important to understand that there's a difference there, because when we try to control everything, then you really throw yourself off because you're feeling like I'm losing control. It's okay to let go. And it's okay to just say, this one is my part. This one is your part. I'm not in charge of everything, but I can do this. So in anything you do, when you start feeling overwhelmed or you start feeling like, oh my God, I lost control of that, you got to stop and say, okay, you know what? Let's come up with a plan together to address this, to figure out how we're going to get through this, right? And those are the plans that we talked about with families. A lot of them felt that one of the stories was their children would say, you know what? The mom was always volunteering and always at school. And while they were in COVID, she didn't know what else to do. They were all at home. So what ended up happening was they started creating a business together and creating wreaths that they would put on their doors, and they would help, and then became a business where they would start selling those wreaths. So they started helping each other out and working through this as a family. And so a lot of the projects they created helped them get through this difficult time. Other things that they did were including gardening, starting their own gardens so that they could see plants growing and all of that, and that helped them just feel calm when they were around their garden. Another area that I share a lot is that I like painting. So painting and creating art together really helps, and doing little projects together is really helpful. So when we worked with this SEL for Families in partnership with ACT, we took some of the lessons that they had, and these are the areas we focused on. We talked about SEL 101 because a lot of people didn't know what it was. What is it? And I shared an overview with you. We talked about how you can actually make a difference in building these skills and having that growth mindset that says, yes, it is possible. We talked about how your brain, when I know Elizabeth Alvarez shared earlier, when you get upset, your body looks different, right? Well, when you get upset and your brain just turns red because you can't focus, you need to know that that's a place where you need to stop, right? Because you're getting too upset. You're not being clear-minded, and you might end up saying or doing something that you wouldn't want to do. We did all that. We shared the information, and then we talked about maintaining composure. How do you cope with stress? What were community resources? Because if you know, and as you know right now, a lot of our community is still struggling with having enough resources. We shared, resources to alleviate food insecurity, financial stress. There's a lot of support that was provided financially by the government, by TEA. A lot of people who were unemployed, and so we shared information about employment opportunities and the stress management techniques that they could use. We also talked about social connection, how it's important to stay connected, and that really helps and benefits when in being optimistic, right? We shared some tools, some examples, and exercises to help improve the outlook, and you learned a lot today about all of that. Those were some of the things that we did that you have been learning today that we covered with families. So SEL for Systems looks at, we continue to work together to create the support for our community. So it's system support in making sure that we address the needs that are out there. So I think what we're doing now is kind of like a Region 1 social emotional support and looking at mental health awareness. We have somebody who focuses on also doing a PD for a mental health toolkit. You heard Elizabeth Alvarez, who's from another area in our office, who works with the younger students. We're going to keep expanding the work to address the areas of need in our community. So what we did is we used the CASEL rubric. And if you haven't heard of CASEL, it's an organization that works on social emotional learning. And we created plans with our districts who were in Gear Up to look at creating a plan, building a foundational support, looking at strengthening adult SEL, and looking at the provide SEL for students and continuous improvement. So the thing that's really important is having a shared vision. When you have a district or an organization, what is the shared vision for that SEL plan? And how do you assess the needs and resources that are there? And figuring out a year-long implementation plan and also budget. The top support's in place. There's a lot of counselors who are providing a lot of services. There's PD that's going on. And like I said, with Gear Up, there's ongoing support and there are SEL lessons and programming for students. But when you look at the needs, there's still a lot of need for a detailed plan. We still need a team that meets regularly. At Region 1, our SEL team is going to meet 3 to 4 times a year. We need more time to look at the challenges of the school year and additional resources which are coming, if you know it, all the federal funds that are happening. Implement SEL programming plans. And so this is where we are based on the data that was collected by ACT when we're looking at the different districts that were part of this SEL just last year. So you can see we're barely in year 1, and we want to get all the way. It's going to take us a few years. It takes 3 to 4 years to implement any program well. And this is where we are, and this is where we want to be. And you can see right there in the planning, the shared vision, the two-way communication, the foundational SEL learning, and the SEL team. So I want to share with you that Annabelle Rangel is continuing that work that we started last year. She's having a conference in September, and it's called Response, Recovery, and Redesign, looking at SEL and figuring what it means when you're looking at accelerated learning, when you're looking at what it means in the classroom, in the reading classroom, in the science classroom, what does that SEL look like? What does that mean? Also, Dr. Rogers is covering character traits, and she continues to review those because those are part of what is required now by the state of Texas. So at the end, when we have covered all of this for the next few years, people will have continued to build their capacity at our service center. We will continue to partner with partners like DHR and others to expand the opportunities for our community because we know it's really important. We know when you look at mental health, and I'm sure they already shared these statistics with you, there was an increase in the amount of referrals, increase in the amount of calls to different organizations that people called in for support. So we know that it's important that we all work on this together to help our community, whether it's Region 1, whether it's DHR, whomever it is. There's a lot of need for support in this area. We need to help each other out and use the resources we have available to us so that our community can be okay, so that our community can be thriving. That's what we want. We want for our community to thrive. We want for all of you to be okay, to be successful, to do well in school, to get the supports you need, and to be able to feel comfortable when you're having a struggle or you're having a certain issue, that you know who to go to, that you don't think that you're in this alone ever, that you know that we're a big community and we're here to support each other. And so it's really important for us that you know that you know that we're here to support you, that is our job because our motto is students first. We always think about our students in everything we do and everything we plan. So there's my contact information that's my email and my number there for the office. And like I said, we have that team, that's the SEL team, but within our office we have about 30 individuals, including the PATHS team. And I told Dr. Alvarado I'm going to add her to the Region 1 SEL team because we're going to be SEL/mental health team, and because we see that there's such need in our community. So thank you all so much for joining us today and for learning with us, and let me know if you have any questions. Thank you.